Broadcast is now starting. All attendees are in listen-only mode.
Good morning. My name is Carmen Boone, and I'm happy to be here today with you. We are just a second. We're having technical difficulties this morning, so I'm gonna disconnect my PowerPoint and connect it once again. Thank you so much for helping us and understanding. So here it comes. There we go. Thank you so much for your patience and understanding. Good morning. My name is Carmen Moon. I'm an education coordinator from Oregon Pacific Area Health Education Center. We're an agency hosted of Samaritan Lebanon Community Hospital. Our agency mission is to promote access to quality health care through community and educational partnerships. Today, I'm happy to be your host and moderator. Let's go over some housekeeping items. On your GoToWebinar control panel, you will notice that all microphones are muted. They'll remain muted during this session. Use the questions menu for typing your inquiries at any time and the chat for comments and answers. We will be monitoring both throughout the presentation. This webinar is being recorded and will be available on our YouTube channel. If you have any question, please email me at the email address you see on your screens right now. For those who need to obtain a certificate, contact hours, CE credits, or CME credits, you must log into www.eeds.com and enter this activity code 67B as in boy, E as in echo, L as in lemon, T as in Tom. Please write it down for your records and consider that it will expire in 1 week. We will email you these instructions and the links within an hour or two after the webinar today. So if you didn't get to write down everything, no worries. We will be emailing you all this information. This presentation is jointly provided by Samaritan Health Services and Oregon Pacific AHEC. And we have today Doctors Moyer and Marsiglio from Oregon Health and Science University. The presenters and the planners of this activity report that we have no conflicts of interest or relevant financial relationships with any commercial entities that might affect the contents of this presentation. Today's webinar is presented by Dr. Danielle Moyer and Dr. Mary Marsiglio. Dr. Danielle Moyer is a pediatric psychologist who uses she, her pronouns. She practices primarily in the Dornbecker Gender Clinic and in association with the OHSU Transgender Health Program. Dr. Moyer specializes in supporting transgender and gender-diverse youth and their families. She is also passionate about research and education, and she strives to promote diversity and inclusion throughout her work. Dr. Moyer originates from Louisiana, so she enjoys good food, live music, and all things spicy. She also loves reading, especially science fiction and fantasy, but she has yet to find a book that she likes more than the Harry Potter series. Dr. Mary Marsiglio, them, is a clinical psychologist in the Transgender Health Program and an assistant professor in family medicine who provides gender-affirming mental health care for gender-diverse, transgender, and non-binary individuals. They provide training, education, and consultation for healthcare providers specific to LGBTQ and trans health within a resiliency framework. Dr. Marsiglio is passionate about using trauma-informed approach to treatment and understanding individual symptoms through a systemic lens. When not at work, they can be found hiking and doing yoga or bird watching. Now I'm gonna transfer the screen to Dr. Moyer and Dr. Marsiglio. And thank you. Without further ado, here they are with you.
Good morning, everyone. Thank you so much for being here. I hope you found a cool spot to sit in as we are together here for the next hour. As you heard, I'm Mary. I use they, them pronouns, and I'm the adult psychologist for the Transgender Health Program. And today we're going to talk with you about mental health considerations for trans and gender diverse youth and adults, specifically how that's been impacted by the COVID-19 pandemic. Next slide, please. We have a few objectives today, and we want to make sure that we leave time for questions, but just want to talk to you a little bit about mental health considerations, including the role of minority stress, risk and resilience, as well as access to affirming medical and mental health care, and the way in which COVID-19 has impacted that. And we also feel like it's really important that we all leave here today, ourselves included, with clear action steps to make toward creating an affirming healthcare environment that supports the well-being and mental health of all TG&D individuals. We have no disclosures. And we want to start the presentation by just acknowledging our ancestors, or as we like to say, our transcestors. So those folks who came before us, who fought to provide equality and for our trans and gender diverse communities, those who have passed doing that work, as well as those who have passed in the pandemic, and acknowledging those folks who carry on that legacy of activism and trying to create a better environment and world for our trans and gender diverse communities. We're not going to spend any time today on language and terminology, but we really encourage you to look up any terms that you might not be familiar with today. University of California, San Francisco has some really wonderful foundational tools and webinars that you can take at your leisure. We will be using transgender and gender diverse, or TGD in short, as we go through the presentation today, and just want to acknowledge that language is always changing, and so that may not feel inclusive to everybody, and so we apologize in advance if that does not feel inclusive, and are definitely open for feedback around that. We also want to acknowledge that oftentimes we get stuck on language. Are we using the right pronouns? Are we using the right term? And what we really just want to encourage you to do is educate yourself as much as you can. And if someone is upset by a term you use, or just apologize and move on. I'm sorry, what pronouns do you use? Or my intention wasn't to hurt you. What identity label do you prefer? And rather than dwelling on it, just correcting yourself and moving on. So in order to frame our conversation for today, we really wanted to highlight some basic foundations in order to provide gender affirming care. And these foundations are essential in order to really be an affirming provider. The first is understanding that gender is a social construct, meaning we as a society made up what it means, what gender is and what it means, and that gender is different than sex assigned at birth. In addition to that, that gender impacts all of us, regardless if you're trans or gender diverse or cisgender, meaning your sex assigned at birth aligns with your gender identity. We all have a gender, and we all, if you really sort of think back and reflect on your gender, identity and journey, that we've all been constrained by the role in which society says we must play according to our gender. And I'm sure we've all had times of feeling liberated within those constraints. Trans and gender diverse people just have to talk about it a lot more and all the time. But it's really essential as a provider to understand that there is overlap and that we all have a gender identity. We also, another foundation we want to talk about is that gender is malleable and fluid. You know, I can think back to my own gender as a kid and the gender I identified with versus my gender now, and all of the ways in which that has changed, things I've tried on, things I fit, things I didn't fit, ways I've labeled myself, ways I've been constrained by that, ways I've been liberated by that. And that is a really important thing when we talk about trans and gender diverse folks, because oftentimes we follow a narrative that we hear in society about gender, and understanding that it's malleable and fluid allows people to move within their gender in a way that feels good to them. Another foundation is that trans and gender diverse people are a group with many identities. So oftentimes we say LGBTQ and we sort of group everybody together. What we want to highlight is that trans folks are people with all sorts of fabulous qualities and multiple identities, and that being trans or gender diverse may not be that primary identity for that person. It just happens to be one of the identities that they hold. But oftentimes when people come in and seek medical care, and providers who aren't as comfortable providing gender affirming care see that and really want to help, and sometimes can over focus on that identity rather than getting to know the person as a whole person. The fourth foundation that we want to talk about is that we all have biases, prejudices, beliefs that get in the way, myself included. I've been doing this work for a long time. I identify as non-binary, yet I still have all of these biases and prejudices and beliefs that get in the way of my work. And oftentimes we just really get stalled in either really being defensive about not having biases or prejudices, or trying to over apologize, or over kind of erase those things. And what we want to offer to you is just acknowledging that this exists, figuring out where they are, figuring out how that comes up in your work, and being able to learn and move forward. That's the best we can do. And lastly, our field has caused harm, and you represent that, meaning from a medical profession, we have pathologized trans and gender diverse people since our inception of our field. And this has caused significant harm to folks by saying that because you are trans, you are sick, you are ill. And people internalize that and struggle to get rid of the shame and guilt that come along with that. And although you personally may not have caused harm or work really hard to represent and stand up for trans folks, we still represent that. So acknowledging that, and acknowledging that you represent a system that has caused harm, and that a patient may not be willing to trust you or feel safe with you right away, and being able to say, I understand you've had negative experiences, and my hope is that I can help heal that through our work together, rather than personalizing what that might feel like for that person. Oftentimes, in our conversation today, we're going to really focus on strength and resilience, but we have to highlight the important disparities among trans and gender diverse communities. Through research, we know that trans and gender diverse folks are at an increased risk for all sorts of things: houselessness, discrimination, lack of access to healthcare, substance use, trauma, social isolation, underemployment, and chronic illnesses for fear of seeking healthcare services and preventative services. And if someone identifies as trans or gender diverse and holds another marginalized identity, such as being Black or a person of color or someone with a disability, these disparities widen even further. And oftentimes this conversation stops here because we are often taught that identity is illness. If we look back over the DSM diagnoses or the ICD codes, what we find is that we have pathologized and said that trans identity means you are sick, rather than understanding the ways in which systemic forces impact illness. So if we think about the fact that we develop and live within multiple systems, we have our individual systems, so the things that we're predisposed to, whether that's to depression or another illness. We also have our social locations, so the privilege that people give us or don't give us depending on how we identify or what we are perceived to look like. We also grow up in a system of religion, of politics, of communities, of neighborhoods, of schools. And our ability to access services, to get our needs met, to have insurance, to be legally represented, to have providers who understand us and understand the concerns and illnesses that impact us. If we don't have that, if we, for example, if trans folks don't even have the ability to get affirming care in the state that they live in, this can cause significant amount of stress, which can trickle down to mental illness. In addition to the environment, the cultural environment, right? We will talk a little bit about all of the laws being currently pushed to prevent trans kids from getting the health care that saves their lives. In addition to the stigma and the cultural stigma that people live in. And so what we hope to do today is try to help shift this narrative that identity is an illness and talk about the ways in which systemic factors impact mental illness and therefore impact the effects of the COVID-19 pandemic. Just to highlight a few things, we won't spend a lot of time on this, but if we think about trans and gender diverse experiences in Oregon, when we talk about systemic factors that influence mental health, 36% of those who saw a healthcare provider in the past year reported having at least one negative experience related to being trans. And this was all done in 2015 and likely very underreported, but still pretty high numbers if we look at even the underreported statistics. 33% of people experience a problem in the past year with their insurance related to being transgender. 22% did not see a doctor when they needed to because of fear of being mistreated. And 15% reported that a professional tried to stop them from being transgender or tried to change their mind. So these are incredibly stressful experiences that impact care and health that are caused by systems, not by individual predispositions. So to bring this point home a little bit further, we really want to acknowledge the role that stigma has in illness and death. So if you go to the right-hand side of this model, there's some words in pink: poverty, sex work, HIV, AIDS. These are categories of society that are often stigmatized. So if we think about poverty, someone who might be houseless, we think about stigma that might come along with that, right? Well, you could have made different choices. Somehow it's your fault for being houseless, right? We stigmatize houselessness quite often. And people who are trans have a disproportionate rate of houselessness in the community. So if we think about that stigma, we think about the ways that stigma leads to harassment and abuse, discrimination and violence, and marginalization, which those impact emotional well-being. They impact our ability to cope. So we may make risky choices. We may use substances to try to cope with the poor situation. We may not access services because we know we're stigmatized there, and will put off preventative care, which will prolong illness, which can lead to sickness and then death. And so it's really important to start to understand the ways in which stigma, discrimination, and especially for the trans and gender diverse community, can lead to mental health concerns, and particularly for people, again, who hold other marginalized identities in addition to being trans or gender diverse. So if we think about the fact that trans and gender diverse people are already at a unique risk for disparities in our society, like we just spoke about, and then we think about the impact of COVID-19 on folks who are already in a vulnerable position, we think about the exacerbation of those existing disparities. So for example, a lot of what we know is through research that a lot of LGBT people, particularly trans people, are underemployed or unemployed. And a lot of the places in which these communities are employed in have been disproportionately impacted by the COVID-19 pandemic. So customer service, restaurant industries, elderly, nursing homes, things like that. And so they're trans and gender diverse folks are more likely to have lost their job or be underemployed or have difficulty finding work, on top of that already being a problem before COVID-19. Delay of medically necessary care. So I work specifically with people who want surgery, and understandably, the hospital was under significant burden and had to cancel all non-essential operations. And the word non-essential got out to the community, and many people were sort of re-traumatized by that, having fought for so many years to understand that medical transition and surgeries are medically necessary, medically important interventions. And there was this sort of disconnect between non-essential versus planned surgeries. And so we had to do a lot of outreach to help folks understand that, yes, we see that your care is important and necessary, and the hospital needs to cancel planned surgeries. But many people have been waiting years and years and years for that surgery, sacrificing a lot of things in their life, relationships, jobs, things like that. And their surgery date was either delayed, or they never had a surgery date, and so all the services to get ready for that surgery were also delayed, which caused huge amount of stress for folks. We saw increased, we're seeing increased wait times. We're seeing research and resources that were previously funded to help start to understand these disparities and to help people be more resourced, that funding has been cut. An increase in violence, especially for those folks who identify as Asian or Black, in addition to transgender or gender diverse. The community spaces that often were a huge protective factor and a huge support for many folks were no longer available, and especially for people who don't have access to internet or equipment where they can do more virtual meetings, that has become difficult. Any systemic progress that has been made was kind of put on hold or redirected because of needing resources for COVID-19. And the worsening of pre-existing conditions, we saw on the previous slide that folks generally delay care due to fear of harassment or discrimination from a healthcare provider. And so those delays and wait times have increased even further, which puts people at a prolonged risk for long-term physical or mental health issues. There has been some research on this, so a lot of this is based on my clinical experience and also some research that has been done, but we're still going to be finding a lot of the impacts as we move forward here. There have been somewhat helpful impacts of COVID-19. The probably biggest one is access to telehealth. This has not been something that insurance was ready to pay for or that systems were equipped to do. Many of my patients who before did not have access to care or who were preventing care because of avoidance and trauma and a lot of other reasons that people don't want to come to the hospital are seeking care now, and that's been a really wonderful thing to see. And trainings for providers across all, areas of Oregon and nationally and internationally have increased and been accessible for folks, as well as highlighting the resilience within the transgender diverse community. Time and time again, when systems fail us, we find a way around that to help support each other. And there's been multiple examples of that have been really wonderful. So what can we do now that we know all of this? And Danielle's going to go into this a little further for youth. But there are supportive factors and protective factors that we know work. And you can just kind of click through all of them, Danielle. We know that social support and feeling validated and gender identity is extremely important, using the right pronouns, using the right name. Being an educated provider and helping folks access care, helping people complete their medical transition. That is a medically necessary intervention for some folks in order to decrease dysphoria, depression, and other mental health issues. Connection and representation of the transgender diverse community. So being able to help people connect to other people who have similar experiences is really important. And probably one of the biggest protective factors, Danielle, you can click this, is you. As a medical provider, if we go to the next slide, what we know is that you are a huge protective factor. You are also at risk for being a big risk factor. If you can go to the next slide. So what we know is that TG folks experiencing depression and suicidal thoughts were significantly less likely to have a provider treat them with respect and significantly more likely to need to educate their providers. Where, oh, sorry about that, 1 second. There we go. Something weird's happening. Also, one of the cons maybe of a virtual is, although this happens in person all the time to me.
I think today it's Monday and it's really hot.
Yeah, here we go. So conversely, transgender diverse adults who have providers that they consider to be trans affirming have reported significantly lower rates of current depression and suicidality. So what we know is that you as a provider have tremendous power in impacting someone's mental health. It is not enough to be kind or tolerate difference. People who have been traumatized or who have been misgendered or who have not felt safe, people who have hurt them have been kind to them and still hurt them. And so it's really important that we all start to understand what does it really mean to be trans affirming and how can we be protective factors rather than risk factors. A big part of doing that is understanding the ways in which systems and contexts impact mental health, which we just went over, and broadening awareness of the trans experience. So a lot of times the trans experience is talked about as what bathroom are you using, what pronouns are you using, when in actuality we know that trans issues actually are so much more than that. A lot of what we talked about, inaccessible mental health care, uneducated medical professionals, violence against trans people, surgery costs, insurance problems, on and on and on. Despite that, there's a thriving community of transgender diverse folks who come together over, despite all of this, to help and support each other. We see this all the time in our practice. Oftentimes people who have surgery struggle to have social support or people to take care of them after surgery. And trans folks who have never met each other link up and just say, you could stay at my house, I'll come visit you at the hospital, just to get people the care and support and validation that they need. And these are just a few examples. And so we really want to highlight that resilience and strength within the community that comes despite everything that we just spoke about.
Okay. Let's see, just need to get my sharing. Okay, does that look okay? I'm going to talk a little bit about risk and resilience among our children and adolescents. A lot of it will be very similar to what Mary's talked about, with a little bit just more specificity around the youth experience. So transgender and gender diverse youth do experience see, my screen not showing. How about now?
There we go. Yep.
Okay, thank you. I'm figuring out the GoToMeeting sharing. So transgender and gender diverse youth do experience higher rates of depression, anxiety, suicidal ideation, self-harm compared to their cisgender peers. And this is not universal or across the board. Our youth are incredibly resilient, and actually the most common co-occurring mental health diagnosis is none at all. But when we look at compared to the rest of the population, we do see this disparity. And the reason these are so high, even though most trans youth don't have co-occurring mental health concerns, is because most of our youth that have one co-occurring mental health diagnosis will also have others as well. And it's important to know that this is related to many factors and not just one singular factor. So the incongruence that a youth experiences between their gender identity and their primary or secondary sex characteristics can cause distress on its own. So that's our gender dysphoria circle here. And so that by itself could be a significant cause of distress. Another thing that I'm going to get into more detail about as part of today's presentation is what we call minority stress factors. And these are chronic stressors experienced by anybody with a minority identity. That could be gender or race, ethnicity, or some other minority identity as well. And then there are other co-occurring mental health concerns that have nothing to do with gender. You know, a lot of folks have a strong family history of anxiety or mood disorders, and we're going to experience those things regardless of whether their gender identity aligns with their sex assigned at birth or not. So the minority stress related to gender diverse folks has been outlined here. And this is not just for youth, this is for adults as well. But we talk about it in the youth section because if you think about it, right, youth become adults, and these are formative years for people where these experiences are really having these interactive effects. So the first group I'm going to talk about are the distal stress factors. These are the things in the environment that are really causing the minority stress from the get-go. And the two that are most important when we're thinking about youth are gender-related rejection, particularly within the family, and then any non-affirmation of gender identity. And that can happen at home, at school, in the community, in the clinic, in the healthcare environment. So these are the things that we're thinking about particularly with youth. And of course, there are also gender-related discrimination and victimization experiences, but these do tend to be factors that are impacting our adults to a higher degree. And then what these do, in addition to creating their own sort of mental health concerns, is that they can lead to these proximal stress factors, or the things that are within the individual. One that we see in our clinic often is internalized transphobia, or a stigma that has been taken from the environment, as Mary was discussing, and sort of put on the individual. This shows up in youth who say things like, well, why can't I wish I could just be a cisgender male instead of a trans male, or I just don't want to be trans, or disliking other trans people. And this can also lead to concealment, or what we call going stealth, which is, you know, going to school and having no one know that they are transgender, but being fully transitioned, which is perfectly acceptable if a youth decides to do that because of the world we live in. But if we lived in a better world, sharing those experiences with friends and close people would actually be helpful in any area of life. I think about our youth that have diabetes, for example, those who don't want to tell their friends or close family members have much poorer adherence because they're not wanting to engage in their medical regimens. But that's not the world that our trans youth live in right now. And then the other thing that comes up a lot are negative expectations about the future, or feeling like they're never going to be able to be affirmed in their gender, never going to be able to access healthcare, not going to be able to transition until they're 18 if their parents aren't supportive, for example. And then on the other side, there are these resiliency factors that can help build resilience in people and impact these pathways. So one of the most prominent ones is feeling a connection to the community and feeling like they have a community that they can fit into. We have some youth who are, you know, the head of their GSA and are doing the advocacy work themselves and are very proud of that. And that's the second factor too, is feeling pride in your gender and recognizing that actually you're unique and that there's nothing wrong with having a gender identity that doesn't align with the sex they were assigned at birth, and really feeling like that is something unique and special about them. And we always include this because if you take nothing away from this presentation, I hope that you take away the importance of using a gender diverse use, chosen name, and pronouns. We can see when youth are affirmed in all of their environments, we see a 71% decrease in depression, 34% decrease in suicidal thoughts, and a 65% decrease in suicide attempts, which is huge. And you know, that's something that anybody can do in any environment, is help to support this. A little bit of specific about the COVID-19 pandemic. So some of these are overlapping with what Mary talked about, and some of them are a bit unique. So lack of access to those community spaces. Although for the youth, a lot of that transitioned to online because they're better at that than us adults. Lots of Discord servers, Discord is on my list of things to figure out, so I can understand the youth. But they quickly transitioned to online spaces, which was nice. But a lack of access to school community. So some people whose parents are maybe not the best environment, but their school is where they have the GSA or other groups like that. Some kids were forced to stay home more with family who were unsupportive or even abusive. The postponing of medical care. And particularly we in the peds world had shortages of puberty blockers, which if you have access to puberty blockers, that can, you know, prevent those secondary sex characteristics from even developing and causing distress in the first place. And we were having significant delays, some related to the pandemic, some not related to the pandemic. And then mental health provider shortages. So transgender and gender diverse youth mental health concerns increased at a higher rate than their cisgender peers during the pandemic, and their access to mental health care did not increase as much as for their cisgender peers. And in a recent study, it showed that 65% of trans youth reported that they had unmet mental health needs that were not being met in the pandemic, as opposed to 28% of cisgender youth. But similar to what Mary was talking about, some positives came out of the pandemic as well. So more youth are coming out than ever before, especially trans feminine youth. While we see a somewhat even spread across at least female and male identified adults, among youth, there's a disproportionately high number of trans masculine individuals. And part of that, I think, is stigma and difficulty coming out at a young age for our trans feminine youth, but without having to be in school, without being around their peers, they felt safer coming out and starting to transition early, which, as I said earlier, access to things like puberty blockers can prevent things like needing surgery in the future. Another thing is that we know that trauma can facilitate the coming out process. Unfortunately, a lot of times a traumatic event will happen, and a young person or an adult will say, you know, have a realization like, I can't keep this inside anymore. Like, you know, life's too short. I need to tell the people around me who I am. And so this year has been, could have facilitated that by just being a very stressful year. And then for youth who have very supportive home environments, but not great school environments, you know, they've been thriving in the pandemic. And then a lot of our youth were already online for school because of bullying or stigma or other things. And those youth weren't as impacted by this big transition that happened. So they had that built-in resilience there. But another thing is going on right now that is really taking our youth a really negative impact on them, and that is the legislation happening around the country in at least 31 states. So this chart, at least at the last point that I checked in on this, which was a few weeks ago, these are the 31 states that were attempting to pass anti-trans youth legislation. The first column labeled M is for medical transition. So these are all the states that are trying to make it illegal to provide gender-affirming care to youth. And there's an asterisk by Arkansas because they they passed that law into effect. So now a provider can be taken to jail for providing those life-saving medications that we're saying. And then the S column is sports bills, so denying trans youth, and particularly trans feminine youth, from playing sports with their peers that have the same gender identity as they do. And this is, we're pretty protected in Oregon, fortunately, from our laws. But it doesn't mean that our youth aren't being impacted. I hear from youth all the time that knowing about these things happening around the country is increasing stress. And because most of our youth are online, they know other kids and adolescents in these states that are having to suffer under these legislative moves. And so before we wrap up, I'm going to wrap up in a second, but we really like this quote by Jess Guerrero, who is a social worker on our team, who said, "Caring for trans people means our work doesn't stop when the office door closes at the end of a session. We have to be clinician advocates, activists. And how do we start changing the world so that it becomes more worthy of trans people?" Oops. And so what do we mean by when we say activism? It just means using the privilege that we have to shift and change these systems of oppression so that our youth and adults don't have to do it for them. And that can look a lot of different ways, from things like showing up to protests and seeking positions in government, enacting legislative change, to the small things like speaking up in a clinic meeting when somebody's pronouns are not being used correctly, changing intake forms to be less gendered. So there are small and large things that can be done every day. So we can work in our environments to change them up to be more affirming. Like even just in our clinics, we noticed that in the bathrooms, the how to give a urine sample signs, the one had all the Disney princesses on it, and the other one had all the Disney princes on it. And it was very as gendered as it possibly could be. So we worked with them to make it more neutral. And then helping youth and adults access gender affirming care, knowing where to refer and where to send folks, working across disciplines to connect people and to make the appropriate referrals and lead to community resources, being curious about resilience and strength and what's helping people, thrive rather than just what's making it difficult. And then really diversifying hiring practices and how we take on faculty and other staff. And so we want to leave you with several concrete and immediate action steps, so you can take any or all of these with you. Learning how to change a patient's name in the systems that you use. Systems are changing every day, and even when we think we've got it figured out. For example, in our Epic system, we have it such that the affirmed name comes up first, but then when we transition to telehealth and Zoom, the Zoom name was initially presented a person's dead name, and that was really traumatizing for people in the beginning. And so there's always new systems to figure out how to put the affirming name in, how to revisit intake forms to be less gendered and less triggering for people. Am I sharing?
Yes.
Right.
Yep.
I am? Okay. Just let me know if it stops because my computer is doing something weird.
It's working great right now.
Okay, great. So we have, at OHSU, we have our pronouns on our badges, but you can also, if you don't have that, there are pens and stickers and other ways to show your pronouns. You can examine note templates. We are busy and we have to write notes efficiently, but that often leads to me seeing many provider notes that are misgendered people and are gendered in general. So revisiting those, getting comfortable assessing risk and resilience, advocating for clinic trainings just like this one. If you're a mental health provider, learning about the historical overdiagnosis of trans people and how not to provide those overdiagnoses, and finding that the role of gender dysphoria and minority stress and what people are dealing with. Learning how to write a letter of support if you're a mental health provider. I meet with a lot of people who say, well, that's not in my scope. And I always want to ask, well, like, how can we make it part of your scope? We need more educated providers doing this work. And then we used to offer and will offer again classes, surgical classes and other classes that you can learn more about this work. And then there's also personal practice where you could just self-reflect on how we as providers are perpetuating risk factors, how we are looking at resilience and strength in our patients. What areas do we need more education in? What is our responsibility as healthcare providers? Where do we need to use our privilege and power to enact change in systems? And then I'm going to show a list of resources that are out there for transgender youth and adults. But first, I wanted to leave you with the Transgender Health Program's contact information, so you can call or email these, and you can also visit our website. And we will make a copy of the slides available if you don't get it down now.
Danielle, we can't see that slide for some reason.
No, this one. Well, as I said, we will make these available, so maybe you'll just get it in written form or in a PDF that we'll send out with the CME information. How does that sound? Unless you want me to try to problem solve.
Oh, it sounds
Great.
We can do that.
So we want to thank everyone for your attention, and we really wanted to leave time for questions and discussion. So we invite you to do that, and we are here to answer any questions that you have.
Thank you. And yeah, while everybody's thinking, typing, I'll take over again, and there we go. And I'll just run some reminders. And please type your questions. I'll give you some time. Things to keep in mind while you write your comments and questions. Please claim your certificate to complete the program evaluation. It'll take just a moment. It'll be of great help to us. Remember, the activity code expires in 1 week. I'll give it to you in a couple of minutes. The webinar is being recorded and will be available on our YouTube channel. We'll send you the link. Feel free to reach out to me or our office if you have any questions or concern. We'll be happy to be of assistance. After the webinar, remember, we will email you the instructions on how to get your certificate and how to watch our videos on our YouTube channel. Now, here is the activity code. Please write it down. If you want to claim your certificate right now, you have the QR code right there. Use your phone and it'll open up on the page you need to go, and you can do it right now. So now let's start with the questions. So we have a question from Danielle. She's asking, for bathroom specimen samples signage, can you give an example of verbiage that reduces any discrimination? Ours currently state female patients, then instructions for cleaning, and then male patients and instructions for cleaning. How can we change these?
That's a great question. Yeah, I sort of started that anecdote and didn't finish it. The conclusion that we came to was for people with vaginas and for people with penises is the language that our bathroom signage currently uses, because we know not all female identified people have vaginas, for example, and vice versa. And the clinic really wanted to keep it upbeat, so they went with, I think, some animal pictures instead of princesses and princes that were like non-gendered. because it was important to them to have a picture. So it was like non-gendered animal friends. So that was what we went with. Great question.
Yeah, and I would just add too, it follows the language that we would encourage providers to do when doing assessment of or physical exams or things like that. When you do, and you focus on organs or body systems rather than gendered language. And so, you know, do you have testes? Do you have a penis? Do you have ovaries? Do you have a vulva? Rather than, oh, you checked woman on here, so I'm going to assume you have all of these organs. And what, for one of the dangers of doing that, for example, is that you miss helping people get the preventative screens that they need. And so the bathroom sign is sort of this representation of kind of the medical system language that needs to change in a lot of different places, including on that sign. So thank you for bringing that up.
Great. Thanks so much for your answer. We got a couple of comments. Our friend Danielle says that they'll be sending these out to the organization and recommend they change the clinic wide, and we get a thank you from Danielle. David, it's requesting the slides because they were cut off when showing, so no worries. David will get you the slides and we'll make sure that everybody gets them. Any other questions? We have another question from, oh, okay. Thanks, David. We'll take your comments in and we'll try to do better. And again, we'll be emailing you, all of you, the slides. And yeah, anybody does have anything to add? If you come up with a question later on, feel free to send me an email and I'll be happy to forward the questions to Danielle and Mary. Sorry, Dr. Moyer and Dr. Marsiglio. And I'll get you your answer, okay? So we, I don't see any more questions. So thank you so much. And I'm so happy to have you here, everybody. And I want to just a last reminder, that's the activity code, or use the QR code. And thank you so much. Thanks to our speakers for sharing your time and knowledge with us. This information has been wonderful. We all needed to know more about this. And thank you all for participating today. And you have now completed the session and you may disconnect. Have a wonderful day, everybody.
Thank you, everyone. Thank you for having us.
Thanks. Bye-bye.